Hello everyone. So today I'm going to make a video on my journey, especially about my M.Sc journey. And the purpose of making this video is क्योंकि अभी M.Sc के एग्ज़ाम्स आने वाले हैं and NORCET is going to happen also. So अगर किसी को ऐसे confusion है कि whether to choose M.Sc or to do NORCET and become a nursing officer, so they can take some ideas and accordingly आप अपने decisions ले सकते हो. So yes, let's get started. So I completed my B.Sc in November 2022 and I started preparing for my NORCET exam from February or March 2023. But NORCET 4 was preponed in that time. एंड उसी टाइम से ऐसा हो गया था कि नाउ नॉर्सेट विल बी कंडक्टेड 2 times in a year एंड दिस टाइम नॉर्सेट 4 was coming, so it will be preponed so that again नॉर्सेट 5 will happen like 2023 में और एक बार हो सके. That is why it was preponed. And I also filled the form for M.Sc. So M.Sc was also preponed due to NORCET 4. So both the exams were preponed and I started my journey in February or March for preparing. So it was like very less time for me to complete the syllabus and get ready for the exams. But I gave both the exams in May month and then June month. And after giving the exams, the most awaited results came. So firstly, I got the results of M.Sc and I secured 188 rank in M.Sc 2023. But I was still confused whether I will get a seat or not. But I thought that I can give a try. And then the NORCET 4 results came and I couldn't clear it in that time, 2023, first attempt, so I couldn't clear it. So of course I chose that I'll do M.Sc in 2023. Then I sat for counseling. So in that you have to make the choices about aims also and about your speciality. So like आपको aims भी चुनने होते हैं and what speciality you want ये भी चुनने होते हैं. So I chose it like I like psychiatry, so I chose psychiatry speciality and whatever whichever aims they are giving seats for psychiatry, I filled all the aims. And after that I chose another specialty and then other aims. Like this I filled my choices and I got a seat for psychiatry specialty in aims Raipur in the first counseling itself. So I was happy and I went for document verification and for confirming that I'm accepting this seat and I do not wish for second round of counseling. But by that time I didn't knew that there are only 4 seats for psychiatry in aims Raipur and no other seats, no other speciality. So only 4 seats were there. So now the journey was started from August 2023 and in actually aims doesn't require any experience, so I was having no experience and I joined M.Sc from August 2023 and we were like 3 what we can say students there. Okay, so 1 girl was there and 1 boy was there. So initial days were very good. We were making bonds and the study load was also less, no research things. So initial days were good. But then the girl candidate, means she was my friend, हम लोग काफ़ी अच्छे फ्रेंड्स बन गए थे and then she was chosen in UP UMS or something and she decided that she will quit the seat, M.Sc seat, and she will join the job. So she went and now we were only 2 students. So 4th seat was like vacant, so this seat was filled in open counseling. So again 1 girl came, we also like became friends. Now the research thing started to happen. सो रिसर्च, दो रिसर्च होते हैं MSc में, वन इज़ ग्रुप रिसर्च एंड द सेकेंड इज़ इंडिविजुअल रिसर्च. So group research of course you have to do in first year along with your like classmates or group mates. So यहाँ पे काफ़ी कम students थे, so it was going to be like 4 students are going to do a group research. बस अब candidates ही नहीं हैं, so in group research कम लोग थे, and along with that you have to do individual research also. उसके भी प्रिपरेशंस, IRC परमिशन लेना एंड IEC परमिशन लेना, सब कुछ फर्स्ट ईयर इटसेल्फ यू हैव टू डू. सो अगेन like some time just went and the male candidate he was also selected in like Tata Cancer Hospital that is in Mumbai. So his priority was also job, so he left the MSc seat and he went for doing job. And now we were only 2 doing the group research, along with like sidewise we were doing all the works of our individual research, so it was kind of getting hectic. So in group research we were doing mixed method study. So those who don't know, in mixed method we use qualitative plus quantitative. So in quantitative we use Likert scale, like एक question रहते हैं which have options, and the samples we administer that like Likert scale to the samples and they choose one option, and according to that we give scoring, and we have scores in the form of numbers. And then qualitative study is also there. So from those samples we select some candidates from which we do one-to-one interview. This was becoming a little hectic for both of us because we were only 2 candidates. So like preparing all the things and writing all the chapters, and we were not very much experienced in doing research from our UG also, like both me and her. We had guides and co-guides, they were guiding us thoroughly along with our journey, but then also you have to do, so this becomes a little hectic. And आपको इंडिविजुअल रिसर्च के लिए भी आपके गाइड और को गाइड होते हैं, एंड ऑल्सो यू कैन टेक हेल्प फ्रॉम अदर टीचर्स एज वेल, बिकॉज सारे ही लोग काफ़ी एक्सपीरियंस्ड होते हैं. मैनी ऑफ देम हैज़ डन MSc, मैनी ऑफ आर doing PhD, many have done PhD, so you get a very good number of good people who have knowledge and experience also. बट देन अल्टीमेटली प्रेशर तो होता ही है. इट्स, आप ऐसे नहीं बोल सकते कि यूं ही हो जाती है MSc, इट्स नॉट लाइक दैट. सो या, I don't know like from where it happened, but one fine day I decided that I want to prepare for NORCET 6. In between this journey I also gave NORCET 5 because मेरे जो friends थे, मैंने जो starting में बोला कि जिन्होंने छोड़ दिया like MSc seat and they went for doing job, they also encouraged me that NORCET 5 you should give because you have fresh knowledge and you can give the exam and crack it. So by the time I had like I was not studying, but then also if they told and I was encouraged, so I filled the form, I gave the exam, I cleared pre, but in mains my rank was not that good, so I couldn't be selected in NORCET 5. So but I was not motivated from within in NORCET 5, but in NORCET 6 I was like I have to crack it because there were many like issues I was facing. First मैंने जैसे बताया मेरे friends ने छोड़ दिया, so it little like demotivated me, not demotivated me, but I was little sad that I also want to crack some exam and I just want to live. Second, आप जब MSc में होते हो you have job security problem, that after doing MSc also you should have experience to fill like any vacancy like lecturer or tutor mainly. So मेरे पास experience है ही नहीं, so how I can fill like aims के लिए tutor post के लिए, how I can apply. So ultimately I'll have to do in some private institute. where again I'll have to work from scratch. मेरी सैलरी उतनी हाई नहीं होगी आफ्टर स्टडिंग फ्रॉम एम्स ऑल्सो. सो ये सारी चीज़ें दिमाग में चल रही थी एंड आई थॉट कि मे बी दिस टाइम डूइंग जॉब इज़ बेटर देन कंप्लीटिंग द MSc. सो एक वो चीज़ थी, जॉब सिक्योरिटी. देन मैंने बोला कि मैं थोड़ी सी सैड भी चल रही थी. देयर वाज पर्सनल लाइफ प्रॉब्लम्स एंड आई वाज फीलिंग लाइक इन्वायरमेंट से एक ऐसा फीलिंग आ रहा था दैट यू आर नॉट डूइंग इनफ इवन दो यू आर ट्राइंग वेरी हार्ड फॉर योर MSc. क्योंकि MSc एक ऐसी डिग्री है इन विच 2 साल कहने को है तुरंत निकल जाती है ऑफ कोर्स, बट इन दोज 2 years यू हैव टू गिव योर हार्ट एंड सोल एंड एवरीथिंग, वॉट एवर यू हैव जस्ट गिव इट. सो इट वॉज बिकमिंग वेरी ओवरवेलमिंग फॉर मी. So I decided that I will prepare for NORCET 6 and if I crack, I'll leave the seat of M.Sc. So I started preparing. हम लोग डेटा कलेक्ट करते थे फॉर आर ग्रुप स्टडी, ग्रुप रिसर्च. उसी बीच में कभी टाइम मिल जाए, कोई और प्रोग्राम्स होते थे, टेस्ट होते थे MSc फर्स्ट ईयर के और क्लासेस होते थे. इन बिटवीन कभी टाइम मिल जाए तो आई यूज्ड टू स्टडी. बट या सो ऐसे ही कर करके थोड़ा थोड़ा करके एंड देन आई गेव NORCET 6. आई क्लियर्ड प्री एंड आई क्लियर्ड मेंस with the rank 1488. And the day I saw the result I was like but then again I was confused whether in this rank I'll get a seat or not. पोस्ट होते हैं वो भी काफ़ी कम आने लगे हैं आजकल. सो पोस्ट भी कम थे. आई थिंक 1500 कुछ पोस्ट थे एंड माई रैंक वॉज 1488. सो आई वॉज अ लिटिल स्केप्टिकल कि मिलेगा कि नहीं. बट this journey has been a very roller coaster for me and the hardest decision came when I had to choose whether I want to live means मैं बताती हूँ इस टाइम पे क्या हुआ था. when the results came, MSc फर्स्ट ईयर और सेकेंड ईयर को they sent for 1 month external posting. okay, so my external posting 1 month this time has came just now and my results are declared. So I have to choose whether I have to go to that external posting or I have to leave the seat of MSc here only, because if I go to external posting it was somewhere in south in India, तो मेरे लिए बहुत मुश्किल होता to do the document verification and make arranging all the other documents, because ये टाइम बहुत पीक है ना, आपको कभी भी बुला सकते हैं डॉक्यूमेंट वेरिफिकेशन के लिए. and I have went to some place where the train connectivity is not good and like आप एक इंस्टीट्यूट से जुड़ जाओगे, एक अदर इंस्टीट्यूट, तो मे बी इट्स पॉसिबल कि वो मुझे अलाउ ना करे, मुझे लीव ना दे टू कम टू अदर प्लेस. सो ये सारी चीज़ मेरे दिमाग में थी. तो आई हैड टू मेक अ डिसीजन वेदर आई वांट टू गो और आई वांट टू जस्ट लिव द सीट ऑफ MSc हियर ओनली. सो आई डिसाइडेड दैट आई वांट टू लीव द सीट ऑफ MSc. मुझे सारे टीचर्स ने बोला कि लाइक व्हाई यू आर डूइंग, आर यू श्योर यू विल गेट, एंड देन आई सेड यस. So this was a little tough decision for me, but I, of course, like I was preparing for NORCET 6 from like my side only, from my heart and soul. So if I have got a good rank, so I decided that whether I'll get a seat or not, I'll again try for maybe next NORCET. But okay, for now I want to leave MSc seat. Later on I'll do. And then luckily, I will not say luckily, but yeah, I got the seat in aiims Devghar, and that was my preference because my hometown is just near Devghar, so my preference was aiims Devghar. And I got to be a nursing officer in aiims Devghar, and it's a privilege for me because many students are trying. I know many candidates are trying. So now many people ask me that ma'am, whether have you completed your MSc, have you completed your MSc? Many students and many of my juniors, many of my friends, they ask me. So yes, I have not completed my MSc. एक साल में मैं कैसे MSc complete करूँ? Okay, so I even एक साल भी complete नहीं हुआ था. It was like maybe 2-3 months में I was having my final year exams, means the main exams of first year. So first year भी पूरी तरीके से complete नहीं हुआ था and I left. So my MSc was not completed for now. Maybe later on I'll again give the exam of MSc and again I'll do my MSc degree from psychiatry specialty. But for now I am a nursing officer at aiims Devghar. Also I have seen that a few people say to me that it was not a good decision because already you were doing MSc from aiims only, so why you chose to be a nursing officer. सो ये डिसीजन काफ़ी पर्सनल होता है. एज आई सेड कि अभी बहुत सारे लोग कंफ्यूज्ड होंगे वेदर टू डू MSc और टू बी अ नर्सिंग ऑफिसर. तो सबके लाइफ के जर्नी अलग होते हैं, सबके लाइफ की प्रायोरिटीज़ अलग होती हैं. मे बी समबडी वांट्स टू बी फाइनेंशियली इंडिपेंडेंट राइट नाउ, मे बी few want to have higher degrees and be in teaching field only, they do not want to do clinicals. So अलग अलग चीज़ें होती हैं. दैट कोई आपको कह नहीं सकता कि विच इज़ द बेस्ट पाथ और विच इज़ द राइट पाथ, क्योंकि सबके जर्नी अलग हैं. ओके, सो यू हैव टू सी व्हाट आर योर प्रायोरिटीज़ एंड व्हाट यू वांट टू डू राइट नाउ. और MSc के लिए यू कैन अप्लाई, जब आप 1-2 साल 3 साल बाद 5 साल बाद यू कैन अप्लाई. MSc आप उस टाइम पे करोगे, यू विल हैव मोर एक्सपीरियंस, मोर वाइडर रेंज ऑफ सीइंग द थिंग्स. क्लिनिकली चीज़ें आपको पता होंगी, क्या इश्यूज़ हैं अभी हमारे क्लिनिकल फील्ड में वो पता होंगी, तो उसके अकॉर्डिंग फिर आप रिसर्च कर सकते हो अपनी. सो बहुत सारी चीज़ें हैं. इट्स नॉट नीडेड कि एक ही पाथ है जो राइट है. ओके, सो यू हैव टू मेक योर ओन कॉल. सो यस, दिस वॉज माई होल जर्नी जो मैंने शॉर्ट में करके सुना दिया. एंड द मेन पर्पज़ कि अगर somebody is feeling stuck, what to do right now, MSc, NORCET, both the exams are here. So of course exams though, but it's on your priorities, what your priorities are, and accordingly आप choose कर सकते हो what you want to go for now. and कोई भी चीज़ बुरी तो नहीं है. like आप whether MSc करो और आप नर्सिंग ऑफिसर बनो एम्स के या फिर कोई भी अदर अच्छे जगह के, इट्स नॉट बैड. बोथ द थिंग्स आर गुड इन देयर ओन वे. सो या, टेक योर कॉल एंड ऑल द